Grounded in research, individually focused, and back at last. Welcome to the Thriving with Stripes podcast. Welcome back to episode 3 of the Thriving with Stripes podcast. My name is Tom Stott. I'm sitting along Dr. Patty Stott. Hi, Dr. Patty.
Hi.
Today we are going to dispel some untruths about movement.
Well, general untruths.
Untruths when people go into movement and hypermobility and paint it with a broad brushstroke of don't do this and don't do that and you can't ever do this.
Right, and we've done this talk before
on this podcast
years ago, and it has to be revisited. And the reason why we're here today talking about it again to bring up the same things is I hate to say I thought that we were past this. I thought that we understood that individuals, even with a diagnosis, have to be seen as individuals, and we have to figure out what that person needs depending on their current state of health, their past history, and what they're looking to move into in the future. And I just had another interaction with a provider who is on an international talk, who was speaking from a patient and a provider perspective. And I'm not trying to throw anybody under the bus. I would love to bring some clarity today because I was not upset at what she said. I was honestly sad. I was sad at the fact that, she still had it in her head as she presented to people. She said, I wish somebody had told me to not do yoga because I had EDS and I was continuing to hurt myself. And that's such a broad and general statement. You cannot apply one incident, one activity, one thing to the broad masses of people in a diagnosis, especially if we don't even know exactly what we're talking about with hypermobile EDS, and that can be a variety of different things and affect people in so many different ways. So I wanted to bring some clarity today and be a little bit more specific. It's kind of like a choose your own adventure book when we look at people and what activities they want to do to see if they can do it, possibly now or in the future.
Sure. And when I hear that right off the bat, I think of my definition of what yoga is different than is right now is different than what I thought it was before I ever practiced or understood that there was a continuum within the body of work of yoga.
Yeah, and that's what, like, within other sports, we can say the same thing,
Sure.
right? Like, we don't have to do a sport at 125%, despite what our brains say sometimes, especially having EDS. We don't have to go above and beyond. And that's not necessarily, we can talk about yoga a lot more and like swimming and things like that to break it down a little bit. But I think that's what people think with yoga is that it's this, you're trying to promote hyperflexibility. And that's not how I practice at all. In fact, my practice is to get myself in alignment and focus on stability in my movement, which can be very difficult for a lot of people. But I don't typically do yin yoga that goes deeper into the poses. I want to one day, but that's not where I currently am.
Sure. And then kind of hearing that, I understand now that as a provider, when you hear somebody else just blanket statement that for a group of patients, we kind of got to be really careful, just like I think we try to practice in our office with intention in our words and how we present things.
Right.
That can be interpreted and spit up and shoot out like real quickly from person to person. And patients take this information directly from us. And it means a lot to them.
Right. Yeah. And that's where, that no matter what we're talking about, I don't know the answer yet to give somebody until we have more conversations about the person, right? So we're exploring like on the individual basis. And my story personally started out with this activity thing is I was a competitive martial artist and I was a runner and I did softball before that. Like I did all of these sports and I had some injuries here and there. Interestingly, as I got older, my injuries were not necessarily from sports, but like walking in a parking lot.
Crossing the street.
But I could do like more intense active things with my body. And I felt like that's what was keeping me healthy and controlled my movement. And I did martial arts, so it was a lot of body control. And I felt like that was keeping me healthy. And the running was helping my mind. And I think part of this inflammatory process actually for me was like the detox part of it with all the sweating. And, I was just getting into yoga when I first met an EDS specialist. It was the first person I saw that knew what EDS was before I saw them and had published some papers. And when we got to the activity piece, and this was an internist, and when we got to the activity piece, he said, well, as long as you're not doing contact sports or running, then you're fine. And I thought, I should probably not tell him that I'm doing those things. And then later on, I was told not to swim or not do yoga. And I swim like a fish and I do well. And I do yoga and I really enjoy it. And I've so far, and it can happen, I haven't injured myself, particularly in the sports outside of what an injury would happen, to
Sure.
somebody that might get one that doesn't have EDS. So I was very confused that an internist was telling a physical therapist who knew their body as well at that point and knew what seemed like was helping me. And I specialized in biomechanics and movement and physiology. And I was kind of surprised that I was being given, recommendations from somebody that didn't necessarily have the training to be able to give those recommendations. And please don't misunderstand me. I think all of our providers that are out there, well, the majority of them really come from a place of they want to help and they're trying to relay information, that they're collaborating. But what we're really finding is that these bodies are unique. So we can't say no to anybody or anything. I think that every time somebody asks us, hey, can I do whatever it might be, there is certainly a pause. And that's where, like you and I think we work a little bit differently in how we approach people of like the movement. Like I put people back together and then you put them back in the sport, I feel like. So I'm more of an alignment and then you're more of like an integrative, like biomechanics and specifics into sports.
So what I'm hearing that not just providers, but if you are a spouse or a significant other, a family member of somebody in this space, and they're considering movement, before we just X something out or we got to have a conversation. We
Yeah,
got to say, is it painful for you right now? What's your control? What's your experience like? We should gather some information, just like doing an intake on anything, and learn more about them, learn about their expertise in the motion. I I would err towards the side of like, hey, let's be very conservative in this, and that if they don't have the experience, sure, but
absolutely.
that's not
Right.
most of our people coming in here, and most people, by the time they reach a specialist, have been movers in some capacity, and they probably long for it. So
Mhm.
an automatic shutdown is not a good bedside manner establishing move.
No, it's not. And we don't want to feed into deconditioning and, the whole, that can affect the autonomic nervous system. So, but we don't want to push somebody too far, right? So that's why, like, this is a fine balance, especially when we get into those individuals that are experiencing more of those layered conditions and they're just inflamed. They're really inflamed. So that can be tough to work with. But I just had this talk with somebody today that it might not be the best place to talk about an exercise program, but it might be a good place to continue working on the inflammation that you're doing so well working on, because that's your current homework to be able to get to a workout plan. And then why don't we just think about healthy movement during the day and see if we can integrate that into like, a walking type of protocol, not specific, like, hey, here's your 3 sets of 10 of these exercises, and that's
Sure.
what I want you to do. But just functional movement. I want people to do things that are pain free when they are highly inflamed, because exercise in itself, the way that we build muscle strength and progress is through breaking down muscle tissue, which is an inflammatory process. So that's where, I challenge the idea of what we consider, please, I hope nobody's offended if I say, because it's my profession, standard physical therapy, of the idea that we have to progress and we have to build strength. And it just might not be the appropriate time for somebody, but there's ways to work around it. Honestly, sometimes like activities and like a sport related movement might be more beneficial for somebody than a very directed strength program. So it's really individualized. But if you want, we could break it down a little bit and talk about some of the different sports that are, that have been rumored to be contraindicated or at the same time promoted by other providers out there.
I'd like to do that. And before we do that, I'm having this fun little full circle moment in my brain as like an athlete and my evolution into this field and being welcomed in from like a coaching athlete mindset. And you and I have done some coaching in the past, knowing that we're going for like an objective. I kind of see all people as athletes, like regardless of their athletic experience, because that's my coaching hat that I'll put on. And what I'm finding myself is, yeah, like 2 to 3 sets of 10, I kind of chuckle at last time because I don't know when the last time I wrote that out on like an exercise protocol or something. I honestly, I'm like 3 to 5 reps is the sweet spot
Right.
because we get good targeted motion and then we back off and make sure we're not inflamed after. But it's this cool little comeback around to let's go for it all. Actually, let's control that baseline inflammatory standpoint. All right, now let's build back in. I'm just sharing what's in my brain.
Yeah.
So sports. So hot ticket, what are they called? Like rage bait, clickbaity.
Oh,
Like you
clickbait.
can't do this.
Yeah. Yeah. And that's always a red flag, right? Like when you pinpoint one thing and you say, this is the worst thing you could do, or, nobody should ever do this, no matter what we're talking about in like health or life in general. That's like medical science doesn't work that way. You could think that you have the right solution for literally every person on the planet, and there will be one person that proves you wrong. So it's just the way that it all works. So clickbait. Let's talk about yoga first then.
Sure.
Let's talk about, this is something that recently I just heard too of, I wish somebody had told me not to do yoga because I have EDS. I'm a yogi. I started yoga after I found out I have EDS. And actually, I really got into it and started training myself after my tethered cord symptoms started, which it was an interesting combo. I did not know I had tethered cord at the time and was like, maybe yoga would help. It did not. It also did not harm in my personal case. So I
Sure.
think everybody should be jumping into yoga, not necessarily, but let's pause and talk about what yoga is. So I think that there's this misconception of two things. One, that it's just this ultra bendy type of movement strategy
Just get
where,
deep into a position as possible.
yeah,
Just try to get as much out of your body as you can. It's
yeah,
not that.
yeah. And actually, that's done with appropriate alignment. When you go to a yin class, you want your joints to be stacked. And so, even with a yin class, you should actually be working within your limits and not pushing past them. And you should be working into alignment. And then the other part of it, whether we're talking about yin or any other yoga class, is the idea that you're taking advantage of hypermobility or hyperflexibility. And in my training, I can't tell you how many times the instructor would come by and nudge my knee and say, get your knee out of hyperextension. And then I'd be struggling and like my muscles are activating. And I'm like, oh my gosh, this is so difficult to hold myself here. And that's why for me, it was so beneficial to learn where my body was not hanging on ligaments and it was able to hold itself in space. So now there are people who do yoga and rely on their hypermobility and hyperflexibility. Um, and if that's not causing pain, I still wouldn't recommend doing it. But okay, if there are people that are experiencing pain with yoga, then we need to figure out why. And then if you'd like to continue to do it, how can we readjust this for you, or what other things could help complement your yoga? But this is, and yoga is also a lifestyle, right? Like it's this idea of non-attachment, and it's broader than just being bendy in class. It's this
Sure.
idea of being comfortable in your own space and your own capabilities for that day when you're on that mat. So that's where I think if you're not going into the intention of having a yogic experience while you're in class, then there can be harm in it.
I think that was some of the coolest growth that I saw you make going through yoga teacher training was some of the mental aspects and some of that spiritual side of things that I would see come out in your martial arts practice, but that I saw like reinvigorated or just with a twist in your yoga teacher training, the 200 or 250-hour block that you did.
Yeah, yeah, and I went through all of that, and like I said, I was experiencing tethered cord symptoms, and I didn't know what they were. And yoga did not get me better. However, in working through the other stuff that I have to get through this, the inflammation and all the neuromobility and everything that we've done, um, it's a completely different body experience that I'm having with yoga again. Like I honestly don't even remember what my body was like before that. So I have no comparison, but I'm just like, oh my gosh, I can touch my toes. And I was just talking the other day, like I am signing up for yoga again. I want to go back to yoga. This is a new body. I want to see like what happens because now I'm having more muscle tightness and fascial tightness, whereas before it was nerve tension and I couldn't get past it. So it's where like depending on what you have, like you can do yoga. It's a possibility. It's just what yoga would you like to do? And now, I'm the type of person I do need feedback. Like I have to sign up for a class and go attend. So for me, and that's why I actually took yoga teacher training is because I wanted to know if I didn't have accessible teachers in the class to be able to correct me, I wanted the education.
Sure.
So that's why I took the classes so that I had the education drilled into me of what I'm looking for when I'm on that mat. If I don't have a teacher in front of me that might have the skill and training to realize, oh gosh, she's hyperextending her knee. She's not going to get all of that out of this exercise. So it can be hard finding somebody to work with to give you, the right attention during a class. I know that we do have some yogis that are out there that do some yoga stuff online for specifically for people that are hypermobile to stay within our body's limitations. So there's some accessibility out there. It just depends on what you need as a person, whether it's like in-person attention or you can do it online.
Sure. All right. So we have yoga on the table. What else do we want to put up on the table?
Swimming. Swimming's another one that you either hear one way or the other, right? Like you shouldn't do it or you should do it because you have EDS. And it's a good one because it's complicated, right? Because not even talking about doing any movement in the water, but just the idea of problems with temperature regulation and chemicals in the water and in the pool area. Like now we're talking mast cell reactions and dysautonomia reactions. So it gets more complicated before we even talk about movement in the water, which is where I think a lot of the conversation is. And I'll be honest, arguments that
Sure.
happen.
And some of those roadblocks get put up just in framing around that. Like that's a great first question to ask somebody. Like, can I go back to swimming? Let's see how reactive you are right now from like a mast cell standpoint and temperature regulation standpoint, autonomic nervous system. Those are good gauge, test the waters, if you will.
Yeah. Yeah. And if we're doing just more of like aquatic therapy for movement, like walking and using the buoyancy to be able to lighten our load and just move around a little bit, then, those individuals, if we can find a more heated pool of like a therapeutic temperature that might offer some of those classes that they have there. So they might keep it at a therapeutic temperature on certain days. Or for the kids swim classes, those pools that have kids swim classes, I think that they have to keep it at a warmer temperature on certain days for the kids. So just something to look into that if for those that aren't a fan of the cold, that yes, there are some pools that do offer warmer temperatures. So that's part of it. And then you don't want to be swimming in a very warm pool, like actually swimming laps.
Sure.
Also, if you have dysautonomia, so just one thing to think about, and then the temperature shift that happens when you get onto the pool deck, and then the temperature shift if you go into the shower. So just things to make yourself aware of and find some strategies to help support that. So that's the autonomic nervous system side of things, and then the inflammatory side of the chemical components. Um, Somebody can be reactive to some of those chemicals in the pool, and whether it's limiting, because if you love the pool though, you can limit your time in there 20 to 30 minutes for some people, or talk to your doctor that's working with your mast cell medications to see if there's a pre-treatment or a timing for your medications for that day that would benefit you more for the pool exposure that'll happen.
Okay, and then what about the act of swimming? We just stay on the front crawl, or if you, I don't think we need to
Depends on the
break
person.
down strokes per se, but
No, this is a choose your own adventure though, right? Like, what are we talking about? Are we talking about somebody that needs to go into the water for active assistive movement, which means that you use the buoyancy to help lift an arm or, for pain relief? very different workout than if you're using and pushing through for resistance to strengthen. So we just have to be mindful of what would we like the person to do in the pool? What's the point of the pool? Because that's where you get people are like, well, the resistance, the drag through the water is going to destabilize joints, and it does for some, but not everybody. And if we're not dragging the arm through the water and we're actually letting it float up, completely different experience. So we just, again, be mindful of what we are doing in the water. And then in regards to swimming, and if we're talking about, I guess, whether it's swimming or resistance in the water, there's this idea that hypermobile shoulders don't do well with swimming. And while there are some strokes that might be more stressful to the joint, like butterfly is one of those, maybe for some people, but not everybody. I have very, very loose shoulders. My shoulders love to swim. I haven't had a stability problem in them as long as, in the pool, as long as I keep my form correct. And my body will let me know almost immediately if my form is off. So it's, again, really patient dependent. So even if somebody has hypermobile shoulders, it doesn't mean that they can't swim. It can mean a number of things. It could mean that they can swim and they have to keep up some strengthening. It could mean that the swimming is keeping up enough strengthening for them. So again, choose your own adventure. I don't know. Tell me more about yourself and then we can make a plan.
Sure. So that's a good schema to kind of operate from, is to evaluate any type of activity. We got to dive deep into it a little bit.
Yeah. Yeah, and like what stroke are we talking about? And there's a lot of people that are like, well, my upper cervical spine is not great. I really want to do freestyle. Okay, go get a snorkel. I'm not kidding. Go get a snorkel so that you don't have to turn your head in the water. I've seen people use it in the pool and I know exactly what you're doing. So, and I get so excited when I see it too, because you're working with what you can. So there's a lot of ways around you know some of our limitations and still doing what we'd like to do. Lots of modifications, adaptations, things that we can work towards.
So I kind of think, uh, like back now to this thought I've always had about, if you're whether you're pushed into sports as a kid or enrolled or parents set you up and whatnot, or you figure out things in high school, I feel like movement kind of self-selects people into it.
Mm-hmm.
I historically had very immobile hips. I knew for a fact I wasn't going to trap a soccer ball with my thigh, like anything above waist level. I just, for what that just sticks out. I remember playing neighborhood stuff and being like, this is not for me. I'm more gonna like run, not have to use my legs. So got into all the sports, not using my feet to do things like all the martial arts that you do. I look and you think gymnastics, swimming, some of these sports just naturally favor in mobility. I won't even use
Yeah.
hypermobility, but think of, I mean, look at what some of these swimmers do on the pool deck as they prep and warm up and then they hop in the water and prep for a backstroke. And the amount of motion that they have available that they're strong through is a lot. There's probably some hyper mobility in there
Sure.
somewhere.
Sure.
So, okay, so self-selection sometimes happens. What about new sports? Is anything you do have any red flags that pop up in your provider brain when people are talking about like, I want to start movement, that you maybe try to pump the brakes on, or is it kind of just, it's obviously person dependent, but anything that you're a little bit more kind of like hesitant on?
It really depends on the person. But the stronger conversations would be high velocity
Okay.
sports and then joint locking sports.
Okay.
So high velocity is still gymnastics. In seeing what they do at higher levels, let me put it
Sure.
that way. Because you need a lot of velocity and power to get through those things. But when I think high velocity too, what actually first comes to mind, because we're in Colorado, is things moving with or under your feet. So skiing, snowboarding, even skating, things like that. It just comes with when there's an impact, there's a higher risk of more catastrophic injury. And that's where I'd really want to make sure that somebody is prepared, like their body is strong enough and there's been enough motor control and training to be able to, handle some shakeups that happen so that we don't have a full fall or so that's, and then the joint locking too. I have had a couple people that come in, they're like, I've decided I want to do martial arts and I'm thinking about Brazilian jiu-jitsu. And I'm like, oh, you are. Any others? Any others like Tai Chi or even Taekwondo, like things that we might have some forms in.
Sure.
So the joint locking is something, I mean, that's the purpose of the sport, right? And judo as well with the throws. So those I will take a pause on. I will tell you both of those individuals that brought that up. I did not say no, but I said, okay, we got a lot to talk about and to work through. And they were able to adapt their training as well to make it a little bit safer. And I always ask when you're, especially if you have an instructor, is and in martial arts is that you talk to that instructor and you let them know that you have limitations and differences so that in the middle of class when you say, hey, I think about I'm going to go pair myself with so and so who might have a little bit more control, like that we're just prepared for.
I remember some of your talks around wrist locks that at some point you had done in your training that you were like, eeks.
Yeah, well, that's the fun thing, right? Is that I don't have a wrist lock. So it's fun. Like, and this was like back in teenage years with, I will say, with young men who got frustrated that my wrist wouldn't lock. And it does hurt at a certain point when you violently thrust it because I don't feel the lock, so I don't go down. I have learned to act.
Go with it. Yeah.
I have learned to act over the years and make people think they have an amazing wrist lock and throw. But it's something I've had to learn because I didn't understand like how far it's supposed to go. It took a lot of practice and learning.
So hearing you talk about velocity sports reminds me of kind of back when we were working sports orthopedic, like outpatient clinic, and talking with people recovering from bigger injuries, surgeries. We take them through range of motion, strength, dynamic stuff, plyos, and now we're moving.
Mm.
And they're like, I'm ready to go back and do X. I'm like, cool. Before we just go all in, we want to do X with more control in a controlled, like putting more of the ball in your cart idea at play. And when I hear you talk about the high velocity, that's what's not there is the control.
Right.
Like you can't control the terrain, and when it goes from powder to ice or like just anything that's out of your control, there's more at play. So there's more inherent risk.
Right. Right. Yeah, it's the inherent risk that makes me a little bit apprehensive in giving a full yes to anybody. That's what like we can't necessarily say yes or no actually to any sport, but we can at least offer those risk factors and then how to train to potentially avoid them.
Okay. I want to talk about running.
Yeah, I mean, I think that we did a whole podcast and you did like a whole thing, like a whole educational series on this years ago. So we could talk about this ad nauseum for a very long time. But if we want to summarize it up, I think that the misconception out there is that, well, ES people have hypermobile joints, and if you pound on hypermobile joints for over a period of time, like with running, then it's going to make their joints break down earlier, and they'll end up with arthritis earlier. We have proved that that's not true in the general population. We're also questioning, you know, how how correlated arthritis is with hypermobility. We're not seeing a clear correlation. I know that might make some people prickly, but we're not. Some people can have it. In fact, it's associated more with classical EDS. It's just what part of the extracellular matrix and the connective tissue is affected for that person because that's more of, some of the joint structure, the breakdown that can happen. So it is possible, but it's not associated, hypermobility is not associated across the board with early development of arthritis. It's not. So that being said, then it takes us into, well, if we're talking about running and the fact that this is moving your body weight, pretty much like a controlled fall over and over, that is a lot of force that's transferred. So do we have the eccentric strength in our muscles to be able to control that movement healthily so that we don't develop muscle imbalances and make other things worse, not necessarily from the activity itself, but from the form during activity? Does that make sense?
Yeah, absolutely. Yeah, I think the kind of bang for your buck with running can be a bit of a slippery slope. Am I strong enough to do it? Yes. My kind of default right now, my brain is like, how's your system looking? How's that inflammatory load
Oh, yeah.
looking? Like, how are you going to take the after effects of trying to go out and move for a few miles?
Yeah. Yeah. So again, like everything else, right? Like there's so much to look into. But running isn't off the board for everybody. I think it's difficult to do distance. Um, Personally, that's my feedback. It's for me, it's difficult. Now I just did like it was 34 miles. I That's just too much. I don't know if I'll ever even go back to a marathon. But if we're talking about somebody that wants to run a few miles a few times a week, I think that's a great conversation to potentially have. And I think if we're talking about, stabilizing the autonomics at some point, figuring out some sort of aerobic or anaerobic consistent plan for somebody is great. It just takes work getting into it.
Yeah, and that's the conversation I probably enjoy having more is not just like, let's write a training plan, but how are we going to get back to those first steps? All right, we need to have a little bit more stability here, a little bit more strength and mobility here. And okay, we check those boxes. How's our aerobic fitness just as a baseline? All right now we can't stand up for more than 10 minutes. We need to stretch those goals out. So it's how to meet things system wide, not just you got to be this strong and go.
Yep.
Um, and inflammatory load is definitely a big cornerstone to that.
Yeah, I kind of laugh at, the programs out there that they call the couch to 5K. And I'm like, they have no idea like how literal that can be. Because I know you work with a lot of people that are literally like couch or bed bound, and like how do we even get you to tolerate vertical? How do we retrain the system to be able to get you back to activity? So I think it's if somebody wants to run, I think it's worth a conversation, even if somebody feels like they're bed bound. I mean, again, there's so many things to go into it. Like, is there upper cervical instability? Even like, where do you wear your ponytail so that it might
Sure.
weight the head down? Like, so
You
many
don't wear
things.
one right now?
You don't wear one?
Not ponytail, no.
Yeah, no, not this year.
So, um, yeah, no, the literal couch to 5Ks is making my mind giggle. Uh, it is the literal couch to 5K,
Yeah.
like the bed to 5K. And what I like about it though is if you have a history of something like I used to run for leisure, like as a recreational activity in college. I love bigger goals that seem like a stretch. That's like there's no way in F and F that I'm getting to that. I
Hmm.
love that goal because it's a carrot. We've talked about dangling carrots being a
Carrots are
variant.
great.
Carrots are so good.
Yeah, I love carrots. I need motivation. I need some sort of external motivation. Like reward systems are great too for individual. Like buy yourself something, go out and do something. But that can be part of like a meeting your goals as they're broken down over time.
I think there's a lot of people, excuse me, with your brain set too, where somebody says like, I don't think you can do that. And I think back to like this Michael Jordan documentary, The Last Dance. He's like, that's all I needed. That's all I
Uh
needed.
huh.
And that's enough fuel to stoke the tank for years.
Yeah, yeah. That one always gets me. Except except if it's anything where again the ground is moving underneath me, like skiing, snowboarding, that's I won't take those bets. I know my body. I need to know where my body is in space because I need to control space around me. I don't work well the other way around. So,
Okay, so running not off the table if we're considering a multi-systemic broad approach and it's scaled and kind of these micro goals are achievable along the way. Rock climbing, we get some rock climbers in here. We get
actually
some
they
rock
found them on
climbers like
what's
highliners,
yeah, it's but no, we yeah, slackliners. We've had some
slackliners, yeah.
slackliners. Body awareness, right? I think it's amazing. I think that it's depending on the level that you get up to with rock climbing, you might be at more risk for tendinous type injuries, or I mean, you're just getting more dynamic, right? And the grip is changing. But if we're talking about lower level rock climbing, then it could be a great shoulder strengthening, body proprioception, and awareness for an individual, depending on how it's done. So, um, I, I mean, might be biased, but a lot of the people I have talked to have felt pretty darn good rock climbing body wise. But again, it's not necessarily where we want to start if somebody's specifically coming in with shoulder pain
Yeah, and to be
or finger
clear,
pain.
none of these exercises are like the go-to. Let's start here. It's not a conversation of like, well, we got to get back to, we have some shoulder stuff. Let's get into rock climbing.
Yeah.
Like these are things that have notoriously just been shot down that
Yeah.
our patients have come in and been like, and then they've shared like, well, so and so said I should stop climbing.
Right.
Like, not necessarily. Maybe we should stop going for big dynamic moves, or I could see how there's some inherent risk in a bouldering gym versus a top line or a sport lead setup where there's some safety
Mhm.
built into it from those awkward impacts. I've seen a few of our climbers have done great in the bouldering gym and just, I think 90% of them have gotten injured on a weird random. I mean, you had an ankle thing like this on
It's
the edge of a
weird.
bouldering mat, like,
Yeah.
or a kid walked under and they had to adjust how they felt. It's those uncontrolled things.
I mean, that's the story of life, right? It's the uncontrolled things that get us.
I
And it's
just
the
I just
same.
like sent this V6 and I twisted my ankle when I dropped 4 feet.
Right. Yeah, it's the weird stuff. And that's what talking about uncontrolled, that's where we get into like the idea of contact sports and being told contact sports are contraindicated. And they're not. Is there a higher risk of something happening? We actually don't know. It's not consistent in the research yet, although they talk about knee ACLs might be more problematic for people that are hypermobile, but there's not necessarily across the board a consensus that these higher impact sports are going to cause injuries more so than the general population. But that being said, there's so much more to connective tissue than just joints, right? We're finding out that some people have this neurological component, this neurological phenotype, and the neurological tissue becomes irritated. So I do have to. I mean, this is really talk to a provider, right? Like if we want somebody to get into a contact sport, or we're thinking about our kids and we're afraid, oh, well, if they get into, football, then what's their risk of head injury? Because I'm reading that maybe there's a prolonged recovery for people with EDS. Well, yes, because we don't quite have all the information out there about this neurological inflammatory recovery and that connective tissue. So, talking to providers that understand that, we might be able to reduce the risk or keep the neurological tissue healthy, or there's ways around it, but there could be an increased risk, yes, for catastrophic sports. Now, I did martial arts. Could some of my head injuries have been involved in my neurological presentation? Maybe, maybe it was. I only had one injury, like one big injury from martial arts specifically, was a broken foot, and it was because I didn't warm up before I went in, and I competed at a very high level. So compared to how much I trained, I didn't really see an increased risk of injury. In fact, I bounced back quicker than most people did.
Sure.
But that's not the same for everybody, right? And whether we're talking about um, not considered a contact sport, but higher catastrophic rate is like gymnastics and things like that. And there are some superpowers that come with some of this hypermobility for some people and hyperflexibility that might make you excel maybe throughout or up until a certain point in whether it's dance or it's gymnastics. And we might, if we recognize this earlier on, we might be able to allow more recovery time or change the way that somebody is training a little bit to give them more health within that space and reduce the risk of injury that we might think is associated with it. But again, we can never predict if something's going to happen to somebody. That's the problem with these contact and catastrophic sports, is that EDS or not, we just don't know what's going to happen.
There's so many things at play that are just to chance.
Yeah, and there's a lot of individuals, yes, when they look back, they're like, maybe that had to do with EDS, but they get through training for sport, high school and college before they ever find out that they have EDS. And they might notice some things, about training and recovery and things like that, but it's not necessarily super obvious.
So, kind of coming back around now, if there's only so much we can control, it just kind of paints a very wide landscape of like things we can't control. And it's a little bit of personal choice, but should always be, conversations like this and thought and recommendations should always be probably like a good first step is just what do you want to get out of it? Like what's most of our patients that we see, we're talking about sport, are adults.
Mhm.
They're post collegiate. If they're trying to get back to something, maybe it's an adult league soccer team or something. But we really want to see, where do you stand with this? Is this for mental health? Like if we're talking about running, are we trying to go out and meditate while we're moving? To be able to see where we can then approach the prescription of what to do.
Right. Yeah. I mean, it's just so highly individualized. I will say from the other side of the conversation and not trying to sort all this thing out and, trying to figure out individual things, we do have a group of activities that do seem to be helpful for people that do have hypermobility, depending on how it's done, of course, right? But Pilates, and there are programs out there. Jeannie Debon has a great program, and I've seen some other ones starting to pop up as well. The Zebra Club is out there that really starts to integrate body awareness into like the beginning stages of working with the body movement. So Pilates could be good for some people. The Feldenkrais method is something that some PTs use. There's a number of different exercise based approaches out there that seem to work better as a start for people with EDS. But if we're talking about sports and specific activity, it's so highly individualized, and we can't say yes or no just because of a diagnosis. Um, there's going to be risks that come up, and that has to be talked about with each person. But I think, actually, like you said, for the mental health component, you brought that up, and what are you doing this for? I argue even more for the mental health
Sure,
component, that if you're telling me I need to do something to help my brain out, then I'd almost fight for getting you back in even more so. But then what does that look like?
sure.
Because I want to get you in
How do we
tomorrow,
modify it?
but
Yeah,
this might be a 6 month to a year path of how we get you back into even looking like what you think it's going to look
yeah,
like.
cool. Yeah, I think some general trends that I'm seeing now is by the time I end up working with somebody, they've exhausted a lot of the big mover exercises and therapeutic approaches and have started to find some success, albeit on their own or through guidance with some of the smaller stability things. A lot of the neural retraining, a lot of work in the space of isometrics and longer holds to
Mm-hmm.
really connect and be like, oh, that's a muscle. Oh, I didn't know I had that. Like,
Mm-hmm.
and be able to connect backwards that way. Okay. Anything else sports wise to cover?
I mean, sure, we could talk about everything, right? But I think those were, I think the biggest ones that I hear about is yoga and swimming and contact sports and running. Um,
Yeah,
don't do
ballet
them or
kind
do
of
them.
falls under dance, like diving, kind of same thing. Some control, like a
Mm-hmm.
little bit of loss of control when you're up in the air, but kind of falls in that space of gymnastics, I guess, too.
Yeah. So it's individuality, right? Like I think we talked about this in the last podcast that we brought this up is that I mean in the best case scenario, if you would like to do an activity, you go to a movement specialist. So a personal trainer, a physical therapist, an athletic trainer, sometimes even an occupational therapist might be able to help if it's more upper extremity. But going to see one of these individuals and saying, I would like to do intersport here, and then have them evaluate the body and the strength and the mobility and the control and the ability to move and catch oneself. Um, and then does that compare to what we would need to see to healthily consider the sport? That would be the best case scenario for
Sure.
literally anything that we're talking about. And even if somebody doesn't pass what, the provider thinks is, hey, this is what I need to see, then how do you work on it and how do you get there? What's the plan to get you there? So that best case scenario, in a happy world where everything falls into place,
Where we
we
have
would want to
providers that specialize in like all of the things. It is funny when I see somebody outside of my sport jurisdiction where I don't have like just an innate volume of information. It's really cool to be curious. Sounding like Ted Lasso here, but like curiosity is so neat because I found that if you can't find somebody that specializes in your movement, find somebody that's curious because they'll ask the questions like, I don't have any business coaching a highliner. Like, I don't. And I'm curious, like, show me some videos, tell me more. I'm a biomechanics person. I could watch you and say, oh, okay, all right, show me somebody else doing. All right, cool. All right, let me see this video. And we can break it down in session. So if you can't find somebody that specializes in whatever you want to do, find a curious provider.
Yeah, absolutely.
Cool.
Mhm. Yeah.
Anything else?
No, I don't think for today.
All right,
Thank you.
what should we come back next time with? Episode 4. We'll have to think about it. Let us know in the future. We're always looking for topics. We're always looking to answer questions. This will be, of course, delayed, but throw some comments below.
Yeah, I love questions.
Cool.
Yeah.
All right, we'll be back next time.